Minister of Health Dr. Frank Anthony issued a second quarter timeline for inoculation in Ghana in keeping with estimates from the approved COVID-19 vaccine candidates through the COVAX facility. While he could not divulge further on which of the vaccines will be distributed to Guyanese, he noted that the two vaccines made by Pfizer and Moderna have been granted emergency use authorization in several countries. The minister explained what the process entails for a vaccine to be approved for distribution in Ghana. As part of the country's immunization plan, healthcare workers and high-risk persons will be the first to receive the initial doses of the vaccines.
Once a vaccine has been approved by the WHO, then we would accept that approval because it meant that the vaccine would have undergone a rigorous set of evaluation. There are also what is called stringent regulatory authorities, and so in the US they have a stringent regulatory authority, meaning that they would take whatever product through all its paces and interrogate it and make sure that it's safe.
The advent of a COVID-19 vaccine may not disrupt the current treatment regimen for the virus. According to Dr. Mahindra Karpin, head of internal medicine at the Durham Public Hospital, the use of remdesivir, the convalescent plasma therapy, will still be needed.
I suspect we will continue to have pretty much the same approach to treatment. Remember, vaccine is supposed to prevent the person from getting sick and getting into a hospital and all that kind of stuff. But we're probably still going to have a proportion of patients who will become sick and admitted to hospital. Hopefully it's going to be a lot less.
The vaccines created by Moderna and Pfizer are made from messenger RNA, which can offer high levels of protection by preventing COVID-19 among people who are vaccinated.
Basically, once the virus is in the cell, for it to replicate, it needs to do so by a process where it produces messenger RNA. That messenger RNA travels out into the protein-producing part of cells and then induce the cells to produce more of the viral particles. So what technology has done is to isolate this messenger RNA and use that to inject into patients. So it's not the actual virus.
Timeka Rodney reporting for the HGP Nightly News.